Hi, I'm Dr. Paul Thomlinson from Compass Health Network. And this is the first episode of 2022 in an ongoing series we're doing with the goal of inspiring hope and promoting wellness by bringing to bear findings from the scientific research, especially psychology and the other brain sciences, on the problems and issues of these times we're living in and living through. This month I want to talk about the psychological and other health effects of poverty and economic disadvantage on the human family. I chose this theme in part because January is National Poverty in America Awareness Month, a time to shine a spotlight on one of the most pervasive and persistent problems in our society. And as the Alliance for Strong Families and Communities has said, this year's observance is as critical as ever before, given the devastation in families and communities throughout the country due to the coronavirus pandemic and subsequent economic upheaval. It's also appropriate to begin with a quote from Dr. Martin Luther King, since we're also celebrating him and his legacy this month. Well over 50 years ago now, he said, "The time has come for us to civilize ourselves by the total, direct, and immediate abolition of poverty." Well, though a lot of progress has been made on many fronts, we have not yet achieved Dr. King's inspirational and aspirational goal. According to the research from the Center for Poverty and Inequality, we still have about 6% of Americans living not just in poverty, but in deep poverty. That means their income is under 50% of the poverty threshold. And we know that children are even more likely to live in deep poverty. Over 8% of all children do so. Speaking of some progress being made, we also know that the gap between urban and rural poverty rates has narrowed over the past 50 years, but rural areas are substantially overall higher in poverty rates still, about 16% compared to about 12% in urban areas. Now, that's of particular concern for Compass, of course, as we serve many predominantly rural communities across our Missouri service area. Getting a little personal here, I have lots of lived experience with growing up in poverty in a rural area, and I suppose that makes this topic very personal to me in many ways. See, I know the indignity of doing the walk of shame, as I thought of it, every Monday morning as a grade schooler, red-faced with embarrassment as I presented myself in front of the entire class every Monday morning to get my free lunch ticket for the week. I know the gnawing anxiety of seeing Mom and Dad struggle with having more month than money as they provided for our large family of hungry mouths. And I know the stigma attached to people who receive government assistance to feed their children. I found a lighthearted way of expressing some of those experiences in a song I wrote called "Love and the Government Cheese." If you don't know the joy and deliciousness of the poor man's Velveeta, as it's sometimes called, you should Google that. But I digress. Back to the research. It's simply a fact that the stress of living in poverty is a major risk factor for nearly every illness, physical and mental, that you can think of, from cancer to heart disease to diabetes to depression and anxiety disorders. Basically, stress impacts how we think, how we function, whether we get diseases, and how we battle disease or not. So treating disease is not about treating physical pathology only, but maybe even more about creating an environment that promotes health and wellness and prevents those diseases. Suffice to say, from a scientific perspective, there's an unequivocal connection between what we call social determinants of health, that is, where you live, right down to the zip code level, socioeconomic status, educational attainment, etc. I mean, there's a relationship between those things and health outcomes. How long we live, our lifespan, infant mortality rates, child development, and the kind of illnesses we get, and on and on. Before I introduce a special guest to close this episode, I want to put a finer point on the effects of poverty by sharing the results of a fascinating study. So, would it surprise you to know that economic disadvantage has an impact on your functional IQ? That is, your ability to reason effectively, to solve problems, to think rationally? Well, it does. A recent study showed clearly that the stress of not being able to pay your bills constrains your mental bandwidth in such a way that it reduces your functional IQ by 13 points. Now, for you statistics geeks like me, that's almost a full standard deviation drop in IQ, which is just huge, and which has tremendous practical consequences. The upshot of that and similar studies is the inescapable conclusion that economic disadvantage and inequity are making our population less rational and less intelligent. It turns out that we really need our brain's executive functioning, which you can think of as our command and control center or the conductor of all of our cognitive skills. We really need that in order to make good decisions and think effectively. And I think we can all agree we've never needed effective thinking more than now. We need these intellectual functions also, it turns out, to resist racist, misogynistic, and other discriminatory or hateful impulses. So the bottom line is, when we're in dire straits financially, we often don't have the emotional and mental bandwidth to do that. That is, to truly think rationally and engage our best selves by being inclusive instead of viciously tribal in many cases. So it makes a lot of sense why Dr. Martin Luther King would be concerned with an immediate abolition of poverty, given these downstream effects of a mindset built from scarcity and inequity. I want to close with a virtual interview I did with my wonderful colleague and friend, Darla Young, who is corporate trainer and chair of the Accessibility and Inclusion Committee for Compass Health Network. Now, she puts her heart and soul into all our efforts to better meet the needs of and include people who've been marginalized for any reason, including poverty. So here's that interview. All right. So, hey, Darla, thank you so much for taking time to contribute to this episode. I really appreciate you. I'm a member of the Darla fan club, as I've probably told you before. And
thank you.
I really appreciate all you do to help Compass be a more sensitive, engaged, inclusive organization. I marvel at the way you chair the committee and how much you get done in that role. And I really just love and appreciate your efforts. So on that note, January is National Poverty in America Awareness Month, and Compass is engaging in a awareness raising by observing it in a number of ways. And I'd like to ask you about that. But really, first of all, a couple other things, prefatory remark. Like, first, why would Compass, which provides for healthcare, behavioral healthcare, oral healthcare, why would such an organization be interested in raising awareness about poverty? I mean, what's the connection?
Good question. Well, we do serve a very large Medicaid population, and the communities that we serve are traditionally the underserved. So we help folks that are at or below that poverty level day to day, every day. So by helping connect folks to Medicaid or insurance, we serve 46 counties across Missouri. We offer the sliding fee scale. What we do is help people. So the connection between raising awareness about poverty and Compass Health Network is natural and organic, because the large majority of the population we serve falls below that poverty line, and doing whatever we can do to help, that's what we do.
Absolutely.
Our day-to-day, the things you mentioned, behavioral health, primary care, dental. And this month, it means raising awareness of the 46 million Americans who live in poverty every single day.
Yeah. And as I mentioned earlier in this episode, the percentage that lives in deep poverty, which is, 50% or below of that, it's, it makes it even more impactful. So, that connection really is very real. And as I mentioned, the research on it is very clear. The highfalutin word is social determinants of health, as you know. That's a tremendous predictor of bad outcomes in all of the areas that Compass provides services in, including dental, oral health care, et cetera. So, well, thank you for that. And so the next thing is, I'd really like to hear about what we're doing, what Compass Health Network is doing to observe this month. What does it mean to observe and contribute to the cause of poverty awareness raising?
Yeah, well, we're observing this month by providing more information to our teams internally about poverty and just the statistics, like you were just saying, those that live in deep poverty, our population, the struggles they have, and how we are making a difference. It's something that we make visible both internally and externally by adding this observation to our website, our social media outlets, and then our email signatures, our corporate newsletter. We want to raise awareness to make that difference and stay motivated in the work that we do every day as we come trying to help our folks every single day. We have outreaches in our community. We have a mobile market that we've partnered with the St. Louis Food Bank.
Love it.
to help make that happen. 5 mobile markets are in the Eastern region. And just in 2021, we served approximately 2,800 families through our mobile market. That's families. That's not people. That's families. So you can
Right.
multiply that a few times. That's
Yeah.
exciting.
Yeah, in my
And
family, that would have been 9 kids. So that we're talking about, that could be a lot of people.
that'd be a lot. Right? Take that
The
times
family I
9,
grew up.
just Paul. That's a lot. Yeah. Yeah, that's just anyone can sign up for this. It's just a wonderful way that we, provide an outreach with our community volunteers, um, and something else we're doing here that we have been able to do through Medicaid Expansion is help folks get access to services by helping them get their insurance.
Yeah.
I have some more impressive numbers there from 7/1/21, so July 1st to December 31st. We took 3,316 applications for Medicaid. That's pretty amazing. So we're making
What's
a
the number
difference by
again?
3,316 applications just for Medicaid. Yeah, in 6 months.
Wow.
Yeah. Yeah.
Incredible.
Pretty incredible.
Well,
Yeah.
that's a lot, and I really appreciate so much about what Compass does, and I'm just so proud to be a part of this organization, as I tell anybody who will get close to me long enough for me to talk to them.
Yeah.
And the people are sick of hearing me talk about how much I love our mission statement, which is to inspire hope, promote wellness. That's the thing that drives this organization. I'm so proud to be a part of an organization that really is truly driven by a mission, and it's a simple one, but it's a powerful one. Inspire hope, promote wellness, and all of those things you talked about are ways in which we can do that. One of our other watchwords at Compass is providing whole person health. And how do you begin to take care of people without considering these other risk factors, including poverty? So that's really well said, and thank you for that. And so I'm gonna wrap this up by asking you about and tying it to our mission statement. If you have any personal, I shared some personal stuff earlier in the episode, and it doesn't have to be personal, but do you have any stories or personal connections to this issue you'd like to share? And particularly, I'm thinking about anything that might contribute to advancing that mission that we have of inspiring hope and promoting wellness.
Yeah, well, I want to say, first of all, that mission statement is what made me want to be a part of this company, this organization, because I was so moved by that. 4 words that make such a difference.
Right.
And one of the things I enjoy doing and get to do at Compass is to teach every day. And in one of my trainings, we share a video about a team member here at Compass who shares about a time that she needed to use WIC so she could take care of her son for just a brief period of time. And I share this video, and it prompts a response from our team members here at Compass, including myself. I, too, as you spoke of, have had my share of government cheese in my life. I know what that tastes like. Yeah.
Love and government cheese.
I love it. I've had those experiences, and we connect to that. And it prompts discussion. And I hear from our team members who have also had similar experiences. And we connect to the experiences our clients have or this population has because many of us have lived them. So when we say inspire hope and promote wellness, we say this with confidence and sincerity because many of us have been in that place where we have needed someone to hold the hope for us until we could find it again.
Absolutely. Beautifully said. And, I teach this class on group psychotherapy, and there's this list. Yeah, there's this list of factors about what makes group therapy work, so-called therapeutic factors. And one of them is the very first one in the textbook is instillation of hope. And so I always spend a lot of time talking about how important that is, what a precious commodity is, and how simple it is for folks to actually inspire hope. And your story, hopefully my story, I mean, the stories of folks who have been there, done that, I don't want to say risen above it, but have walked through it, have lived experience, of the challenges that we're talking about, and have continued to soldier on and put one foot in front of the other. That by itself, I think, is inspiring of hope. So
it is, and our team members do that every day by the work they do and approaching our clients with the respect and with humility that we all deserve. So I'm very proud to be a part of our mission here at Compass.
You and me both, sister. Thank you so much for your time.
Absolutely.
And I'll see you on the flip side.
Yeah, thanks so much, Paul.
Thank you.